Good evening and welcome to Tok Piksa. On the show tonight, we follow Bethany Harriman to Enga, where the Tribal Foundation and General Electrical are piloting the use of VScan, a portable scanning device that is proving vitally useful for the hardworking staff of health centers in the remote areas of the province. We also join Scott White as he takes a look at an eye care program that is clearing the vision problems in the Bulolo district and changing lives in as little time as 20 minutes. But first, we travel to East New Britain, where reporter Edwin Fidelis walks us through the latest information on how the prolonged dry season is having an effect in the New Guinea Islands.
At the National Agriculture Research Institute at Karavat in the Gazelle district of East New Britain Province, Matthew Poinau and John Bokoso lead a drought research team. In the last 2 years, their agriculture research centers around the management and cultivation of drought-tolerant crops and the distribution of planting materials to farmers. This is one of the taro demonstration plots, planted under a canopy of trees to utilize soil moisture that has been preserved in the soil during the drought period.
Any other crops that the farmer really needs to sustain their livelihood, they have to use this similar concept because it's all about moisture conservation. If we can conserve moisture, then we can grow crops. And there are certain spots, although we're experiencing drought, but it's only in a mild drought. It's not that serious at the moment, but certainly it depends on which locations it's affecting the areas.
While the main focus is to produce enough food supply, NARI is also looking at maintaining a constant supply of planting materials that can be preserved and used over time.
Because by providing marulungan or leave by pulling on down Pasimol Hasbro or Taros in March. Okay, Narabla, suppose you got drain also in the flyer. Plus, water start long in. Me play planning to this Taro and in it long. Inside is a drain, because inside it's still full of moisture. The moisture is in the soil. So I mean give him this moisture long or taro. Long save him again for the next 9 months, because taro by supposed to non plamuna. And by the time supposed to be sent or this like kind of situation, we can always harvest and then rapid multiply or planting material one time or sakas now corn and for distribution.
At another demonstration plot, this banana patch is overgrown with weeds. The weeds help reduce direct soil exposure to sunlight that may cause the soil to lose its moisture, causing plants to die as a result.
Sites where there's a lot of logging, there's a lot of other gardening activities that's happening, and people are exposing soil to direct radiation of light or sunlight. That's when crops have high chances of being dying because they are exposed to drought effects. But where there's forestry and there's other things in place, we need to use that similar strategy to maintain drought tolerant crops. Yeah. Crops are not really resistant at all. They have some tolerance, but under very extreme conditions, we will certainly lose them. So during the drought period, we have to look for ways or coping strategies in order to sustain materials until we have normal conditions again, and then we can grow the crops. And the main focus will be to bulk the materials and then redistribute again to the stakeholders or the farmers.
NARI's Karavat Agriculture Station is one of several agriculture centers managed by the National Agriculture Research Institute, and it has been in the forefront of agriculture research and development, serving agriculture needs of provinces within the New Guinea Islands region.
And so, for example, like in East New Britain, inland Opomia may not be severely affected. 1997-98 drought assessment, which we did earlier on, a place like Hawana did not have any effects of drought at all. It's because of the topography, the landform, the forest is there, vegetation is still there, so they are able to grow crops. But then when you come to the lower sites, like for example in Rabaul, which was severely affected, and even Kokopo, they had not enough water. People are currently going to the process of buying and distributing water.
More than 80% of Papua New Guineans still live a subsistence lifestyle using age-old agriculture methods. NARI is now pushing for its inventions to be adopted by drought-affected areas that are slowly beginning to lose their food supply to the current nature's onslaught. But it said it needs more support from other stakeholders and the government in terms of participation so that its research can be used effectively by farmers.
NARI originally planned to have about 64 resource centers throughout the country, but because it doesn't have the capacity to do that, it basically partners with any interested stakeholders that who are willing to take ownership of this and run it as their own. Then our job is to impart the skills and know-how on how to use these specific coping strategies to address the drought. And if they can do that, then it sort of helps everybody to contribute in a way of helping themselves to sustain livelihood during this the phenomenon or drought problem.
You're watching Tok Piksa. An American-developed portable scanning device is being tested in 7 health facilities in the Enga Province, including Wabek General and Sapos District Hospital. A pilot program backed by non-government organization Tribal Foundation and the Enga provincial government will run for 2 years. Though the VScan device is new, all stakeholders in the program say it may be the solution to Papua New Guinea's high rate of infant maternal mortality. Bethany Harriman brings us this story from the Enga Province.
Enga has become the first Papua New Guinean province to test trial a new portable scanning device. Because of the province's remoteness, there is a high number of infant and maternal mortality cases. In Papua New Guinea, statistics show that 733 mothers die per every 100,000 live births. That's the highest in the Pacific region and one of the highest in the world. Catholic-run Yampu Health Center is one health facility in Kompiam that acts as a rural hospital for over 20,000 people scattered across the mountains and valleys of the area. The health center is the first point of checkups for pregnant mothers who often deliver the babies there. On Thursday, 2 American doctors, Mark Hauswald and his wife Nancy, seen in these pictures using a new scanning device developed by American company General Electronics on a mother in the health center. The doctors were brought into the country by non-government organization Tribal Foundation to help Engan medical officers understand the product.
This does 2 things. First of all, it makes it possible to screen them if they're high risk. And you can actually take the machine out into rural areas, carry it out, charge it off of a vehicle. So you can go to where the woman is. And then the other thing is you can do that screening even in the hospital, in the facility, looking for things like twins, the placenta being in the wrong place, breech babies. If you can get those women to deliver in a facility, you really decrease their risk.
Sister Jadwiga Felice-Jacques is a nursing officer who works at the center. She says the device is portable and means they can go to the villages to do checkups.
I think this one will help us to really examine the mothers and also to run the antenatal clinic. Even we can take to the places when we run MCH clinics, when we go to the places like the bush food patrols. I think I'm very small and very easy to use.
So this gives you portability. It gives you a very good image. The image is really as good as a standard advanced portable unit, non-portable unit. The screen's a little bit smaller, but you get used to that pretty quickly.
The VScan device gives an accurate image of the growth, development and position of the baby in a mother's womb. That information is vital for health professionals to monitor safely the birth of the child and also give some level of guarantee to the survival of the mother during labor. In Wapenamanda district of the Enga Province, several hours drive from Pompiam's Yampu Health Center, is Lutheran-run Mambisanda Hospital. Mambisanda's antenatal facility is one of the best in the Enga Province. Mothers come all over the province to give birth here.
In Mambisanda Hospital, we meet Jenny One Piece and her newborn baby in the antenatal facility after she gave birth to a child on the hospital's footpath.
Nurses attending to young mother Jenny One Piece from a remote village in Wapenamanda, who was carried by a makeshift stretcher to a nearby road where she was picked up by a car and brought to the hospital after she began experiencing labor pains at her village. She arrived at the hospital but delivered her baby outside on the footpath.
No, this baby was born just at the walkway, meaning that mother wanted to wait for the pains. As soon as the pain came on, she didn't wait long. She just delivered.
This young mom's story brings to attention the importance of a scanning device in rural hospitals around Papua New Guinea's health facilities during pregnancy checkups. The new scanning device developed by the American company was introduced to the hospital several days ago. Nursing Director Sister Agnes Corralio says it will make a difference.
So when we scan them and say this is how old the baby is inside, and this day this baby should be coming, so you don't wait for the pain.
Yes.
You come and wait for the pain in the ward.
Yes. Doctors from Wabeg Hospital are also using the product for antenatal care and other examinations before surgeries.
For certain cases, certain medical cases, they help a lot, like in terms of gallbladder stones and other things, other medical issues that you would require ultrasound scan.
This ultrasound is also good for things like pneumonia, broken bones, trauma, injuries to the abdomen, things like that, where you really can't get a full-sized ultrasound everywhere.
Enga's Provincial Health Authority, Sapos district-based physician Dr. Solomon Khalid explains that the device can be used for a range of medical examinations, but the challenges of implementation still
Various
remain.
Conditions are, you have antenatal mothers coming in for clinics, you have people with tumors in various parts of their bodies, you may have people coming in with fractures. So these devices can be used for scanning those type of patients, but the challenge for us now would be to actually take time to train and have training workshops, provide resources, and then have a consistency in terms of the visitations for our outreach programs.
You're with Tok Piksa. In the past 2 weeks, a Papua New Guinean eye care team has been in Bulolo. The team has been operating on patients, removing cataracts, and providing advice. Scott Wyder with his report of life-changing operations by a team committed to their trade.
For the past week, a team from the Goroka General Hospital has been conducting vital operations on patients suffering from cataracts. Most of the patients are senior citizens from all over the Bulolo district, and they've been brought here through a district eye care program that began about 2 years ago.
All man sitting all the same time, all blind now. That's the end of the life. So time you look outcome where all can look him and then all can live a normal life after operation, cataract surgery. EMTV give him big plamamas, looking blind, and even the blind people all by amamas looking all bubu all kenna.
Team leader Damien Sungu has been all over the country, and each trip is a personally rewarding experience for every member of the team.
Plant all blind line all stuff, remote part, all noctins like service. So it's like I'm bringing satisfaction lo miblalo. Continue lo more.
When we see a lot of people with vision problem, they think that there is no hope for them and they are going to be blind for the rest of their life. But when they come for the operation and surgery, after that, they can see again. It's really satisfying. See them very happy.
Because people like give another chance of life, put a smile on face for all. That's the emotional part lo, as a eye care provider.
Sungu is responsible for bringing the patients through a preparatory stage prior to surgery. All adult patients are fully conscious during the surgery.
It's the painful part of the eye operation. The rest, okay, mama look straight, want to look shoot back out.
First, anesthetic is injected with a needle into the lower part of the eyelid to ensure the patient feels no pain when they're operated on.
Every year we are developing more cataract patients, and then right now we got less number of all surgeons, ophthalmologists there.
A cataract is the clouding of the lens of the eye. If left untreated, a person can become blind. In Papua New Guinea, more than 40,000 people suffer from cataracts. Many of them are in rural areas where transportation is difficult and the cost of an operation is unaffordable. Programs like this offer a new lease on life for those who already have given up hope of ever seeing again.
I'd finished my internship and I was thinking, what am I going to do now? And I thought I'd do general surgery, but then there was an African consultant employed by the clinic, and I was asked by the Director of Medical Services to go and spend 9 weeks while I was looking for a job. And those 9 weeks, I guess, are history, and I've been doing eye surgery since 2009.
For eye surgeon Dr. Alex Mill, healing the blind has turned into a mission for him and his team.
For us to be able to help people the way we do, the satisfaction is instantaneous almost. 1 minute they can't see anything, and then you do the surgery, and then the next day you have a person who you've been able to change their life.
In the operating room, Dr. Mel spends an average of 15 minutes per patient, provided there are no complications. It is a relatively simple operation where the damaged lens is removed and a new one inserted into the eye. At the end of the surgery, the eye is covered and the patient escorted out of the room. For Elizabeth Crissell, the program has given her the opportunity to regain the sight she lost in a previous accident.
Because Mr. Tram no write Bible or written book or kind of say looking man em hatro lo mi. Na mi go worry lo hype lo mi. So now me come no operation now and me feel mo say me am a master.
The process of identifying those who needed the surgery took several weeks and involved hours, sometimes days of walking over rugged terrain. At the end, this program will have a tremendous impact on the lives of ordinary Papua New Guineans.
We hope you've enjoyed our stories on Tok Piksa tonight. If you missed any part of the show, you can catch the replay on Wednesday evening. And until we do this again next Sunday, I'm Neville Choi. Good night.